Approximately 10% of American children have been diagnosed with asthma, and that number continues to rise. However, a group of specialists at the University of Missouri Health System have been tackling this problem with a very unique program called Asthma Ready Communities. With me today on Missouri Medical Focus is Dr. Ben Francisco, director of the program as well as a clinician and researcher at MU. Dr. Francisco, what is Asthma Ready Communities?
Asthma Ready Communities is an effort to reach out to all the different people and places where children with asthma need support. That includes the school, the hospital, clinics, and community locations where we can help kids.
And when you say support, really what you're talking about is getting asthma under control to make sure it doesn't flare into an actual medical emergency, correct?
Yeah, that's right. And the thing that's so important is asthma changes from day to day, even from hour to hour. So even though you saw your doctor or nurse practitioner 3 months ago and things were good, today may be very different.
Why does asthma change so drastically and in many cases so quickly?
Asthma causes the airways to be sensitive to a range of things that include viruses that would cause a common cold, as well as airborne things that might only be in the air at a certain season. We just passed through the time of year when we have the highest counts for weed pollen and also mold. So if your airways are sensitive to those things, then you have a lot more trouble in September and October.
So asthma's never really gone.
It is not gone, but the great thing is with a twice daily medicine called the inhaled corticosteroid or ICS, you can shut down those changes in the airway so they're not super sensitive, and you can get through the season or the next cold without having asthma symptoms that require medication.
You mentioned allergens as a way of exacerbating asthma or bringing on an asthma attack. Right. What are some of the other elements or conditions that can trigger asthma?
So it's interesting, if you travel around the state, you see different challenges for children. If you live in downtown St. Louis or Kansas City and there's tens of thousands of trucks going across the interstate near your house, then you have sulfur dioxide and particles from the incomplete burning of diesel. You can also have latex particles from the tires that are ground off. So environmental things. If you live down in the Boot Hill of Missouri, then we have heavy agriculture with aerial dispersal of insecticides and pesticides, and all of those things can become a problem for the airway.
Is there a way to test what is triggering asthma in your child?
There is a way to test, and the best test probably is the skin prick test, because the results are known within 15 minutes. So while you're still in clinic, we can talk about what you're sensitive to and develop some plans to reduce your exposure, or at least plan for more aggressive treatment during that time of year.
What are the signs and symptoms of asthma that a parent should be looking for if there's a suspicion?
So the signs include persistent cough, shortness of breath, wheezing or a whistling sound that you make when you try to exhale air from your lungs. There's also patterns that are common. Asthma tends to be worse at night, in the middle of the night, between 2 and 4 in the morning. The symptoms can come on with cold air exposure, with exertion, and with the common cold.
You're listening to Missouri Medical Focus on KBIA 91.3 FM, and our discussion concerns asthma. How many children have benefited from asthma-ready communities?
So we don't have an exact number, but I can tell you that we've trained and provided equipment to more than 500 school nurses across the state, and we've trained more than 100 clinical teams and provided equipment. So it's certainly in the thousands of children.
Logistically, how does the program work?
We have both online training, so that someone in a rural county, a school nurse or a primary care provider, can do asthma training online and earn continuing education credit. They also receive equipment. In the case of clinics, we go to the site always to deliver the equipment and to sit and talk with the clinic about things that they want to do to improve asthma care. So we're there to strengthen the healthcare team, whatever the setting of care.
You mentioned having asthma under control. What does it mean to have it under control?
Having asthma under control means that you have no limitations based on your breathing. You can sleep through the night. You can engage in physical activity that might involve a lot of running or exertion. It also means that you do not have risk for future hospital admissions or asthma attacks that could be life-threatening.
Are there ways outside of using medication that asthma can be controlled or at least mitigated?
Absolutely, and this is our focus, is that you use just the amount of medicine you need to attain good control. But being physically active, aerobic activity, builds bigger lungs. Consuming a diet rich in vegetables and fruits and antioxidants reduces the inflammation level. Being weight appropriate reduces the risk of asthma attacks and actually getting asthma in the future. About 1 in 5 children are allergic to dust mites. These are living things that you can find in the carpet, your pillows, your mattress, and once you're sensitized to it, it's a big part of your allergy and asthma symptoms. So absolutely, if you know you're allergic, you can do some simple things to drop the exposure so you have far less symptoms and probably need less medication.
What's the most important message about asthma that you think we should know?
Almost everyone has the experience in the asthma world of taking albuterol and breathing a little better, and it's important to understand that's like Tylenol or ibuprofen. You're treating a symptom. The most important thing to know is that if you have persistent asthma, it takes an inhaled corticosteroid that you breathe correctly deep into your lungs twice a day for about 3 months to completely heal this process of inflammation that we call asthma. We have really strong evidence now after a 3-year study looking at asthma-trained school nurses that they can have a very big impact on our children at school, meaning that they can help coach them to be better breathers of their medicine. They can assess their airflow and report back to us when things are not going well. They can help children realize the importance of avoiding triggers like tobacco smoke, which is our worst trigger, and also other things in the environment that kids can watch for and avoid. So it's very encouraging to know that just getting our school nurses on the team has a big positive impact on asthma outcomes.
I'd like to thank Dr. Francisco for being my guest for Missouri Medical Focus. I'm Jeff Helsher.